Good afternoon. My name is Sakina Alston, and I am a MSN student at ECPI University in Nursing 611, that is Healthcare Systems Management with Dr. Hitt. I am here to discuss managerial behaviors with you on air. So I'm going to answer a few questions and just discuss a few topics. So first, I'd like to discuss management behavior in work environments that promote excellence and safety. So the main part is to promoting excellence and safety in today's healthcare environment necessitates the ability to lead change as the system is continuously evolving. The American Organization of Nurse Executives developed competencies for leading change. They recommend using change theory to plan for implementation of organizational theories. They recommend that the nursing leaders need to serve as a change agent who helps others understand the necessity, impact, process, and importance of change, support staff during times of difficult transitions, recognize self-reaction to change and be flexible towards change, adapt leadership style to situational needs. And this can be cited in Rousel 2011. It's also noted by Rousel 2011 that shared accountability and promotion and utilization of collective talents within the organization, despite the level in the managerial hierarchy, is key to promoting excellence and safety in an organization. So how does management behavior in this type of setting differ from one in which the excellence and safety are not priorities? Environments that do not promote excellence and safety place the managerial hierarchy at the forefront of decision-making and operations. Opportunities are often provided first to those employees who've been with the company longest versus those who are educated, experienced, and ready to accomplish the required task. But because they may have been with the company for the least amount of time. So they're lower on the managerial hierarchy within the organization. So this promotes mistrust and loss of respect. When people's talents are under-acknowledged and underutilized, they lose respect for the people making the decisions about how talents will be utilized and recognized. So this mismanagement of talents, experience, and skill results in high turnover rates and financial loss, which will also impact safety as we have more shortages of employees related to several factors, including lack of money to hire new resources and train new resources. So what communication and decision-making strategies are fostered in work environments that promote excellence and safety? So when everybody's skills are assessed, their skills, talents, emotional ability are assessed and utilized to their fullest potential in a more equal and knowledge-sharing based manner that promotes optimized utilization of all the skills within an organization, a transparent and trustworthy communication is developed. Comprehensive decision-making that includes input from all entities impacted by any manipulation within the system is fostered when the work environment promotes excellence and safety as well. In organizations where excellence is promoted, the employees are rewarded for their outstanding performance. This helps trust to be developed as well. Describe transformational leadership and evidence-based management. How are they the same and how are they different? So transformational leaders have the ability to translate data from direct care nursing staff into process improvement projects on the unit. This relationship facilitates incorporation of the end users, nurses, concerns, and knowledge into the outcome of the design of the workflow and processes that impact them the most and that they impact. Transformational leaders grow their resources into supplemental leaders by encouraging knowledge sharing among associates and persons who share common interests. The transformational leader can entice the followers to work together to complete tasks related to goals tied to an investment for each participant. Like transformational leadership, evidence-based managerial styles benefit from the recorded and observed data from anything associated with managing the workflow of nursing staff and patients. That's page 2004. These recordings and observations can be analyzed and compared to various situations, and the findings can be used to improve workflow and process. Clinical leaders have been encouraged to engage in evidence-based practice, but management models have not functioned from empirically suggested management practice in the same way. There's less awareness of the importance of evidence-based management. Therefore, there is less funding for the same. Less research equates to less scholarly articles and less published literature on the topic. So we don't know as much about how evidence-based management will improve practice, safety, and excellence, but we do have more research on clinical leadership aspects and transformational leaders. We have some evidence on that, but we need to tie the two together or learn from each topic. So evidence-based management is important to the successful implementation of changes required by today's rapidly changing complex adaptive systems of healthcare. Transformational leaders are charged with improving patient safety and work environment safety, functioning as the change agent and visionary who can lead others through the process and mental challenges associated with functioning in a complex adaptive system, and they need the tools to complete the task. A push for more studies on evidence-based management would help to establish a working knowledge base for transformational leaders to use as a resource for frameworks and models that will aid them in instituting change and transformation in a way that has been proven to work. So what is emotional intelligence and what role does it play in nursing management? As a hospital administrator, what are your expectations for behavior of your managers? Emotional intelligence is the heightened awareness of one's own emotional triggers and reactions, as well as the management of those emotions in an emotional intensive role. So all the people's emotions that also you will be managing when they are working in an emotional intensive role, such as nursing practice. Nursing leaders need to be aware of their own emotional intelligence and have the ability to predict, understand, and manage the array of emotions and emotional stresses related to their followers. Understanding of emotional intelligence will guide the approach and expectations the leader has for his followers. It will help the nurse administrator to remain cognizant of risk for nurse burnout and need for collective bargaining as they push to lead the required organizational changes. As a nurse administrator, I expect my nurse managers to manage situations and lead people. Practices that will help my nurse managers accomplish tasks include obtaining a comprehensive understanding of the goals intended for the organization and the resources available to accomplish the task. Understanding of the available resources will include emotional assessment of the resources and skill, talent, and experience assessment of the resources available. The managers will make the most optimal use of the resources on the unit, despite any ranking. Skills and talents will be acknowledged and rewarded. Lack of skills will be nurtured and grown in a safe environment of knowledge sharing. New leaders will emerge as confidence of followers increases. So, in summary, I feel like transformational leaders will need evidence-based managerial and leadership models to follow so that they can effectively and successfully institute and lead organizational changes while they monitor and account for their emotional intelligence as well as the emotional stresses and intelligence of all the people that they lead. That is not something that you can just be born into. It will have to be a focused study on what management and leadership styles work and facilitate change leaders to accomplish the task of being a visionary in today's healthcare climate. Thank you for watching. That is about all.